Hi, I'm Audra. It's nice to meet you.
Hi.
What's your name?
Maria.
It's nice to meet you, Maria. Have a seat.
Thank you.
You're welcome. What brings you in today?
I've been having a little difficulty with sleeping, and I've been really missing my family bad. I'm a first generation Mexican immigrant here, and I'm just having trouble focusing. My RA suggested that I come over here to talk to you. I've had therapy in the past, but it's just been really, kind of difficult for me with missing my family. I've self-injured in the past, and I just can't focus, and I'm scared.
Well, thank you for sharing all of that. I can imagine that it's hard to go through all of those emotions and feelings. But if it's okay with you, I'd like to get some more background information before we start digging into that. Is that okay with you?
It's okay.
So I'd like to start by saying anything you tell me is confidential. The only reason that I would break confidentiality is if you were going to harm yourself or others, and I had to call and have you admitted for that. Do you understand?
And have me admitted what? What?
If you indicated to me that you were going to harm yourself or someone else, I would have to call the authorities and let them know, and they would take it from there, which could include hospital admission.
Okay, I understand.
And you're comfortable moving forward?
Yes.
Good. So I'd also like to give you an idea of what counseling is going to look like. So for this first session, I'd like to get some background information, and then we'll move on to goal setting, and we'll monitor the progress of your goals up until termination. Does that sound like a good plan?
Yes, it does.
Okay, so
Just as long as I get some help, because I can't really sleep.
Sure.
And I don't know what's going on. I'm missing my family. I can't get in touch with my family. They made them go back to Mexico, and I'm here all alone by myself, but I have no one.
Okay, so why don't you tell me a little bit more about your family?
Well, I have a mother and a father. They were here with me when I first started school. We moved here when I was 15 years old, and I went to high school here, and we thought we were gonna make our family here, but something happened with this new president we have, and they made my mother and my father go back, and now I'm living with an uncle. And when I go back home, when I go back to my uncle's house after I get out of school, I'm having a lot of anxiety because I miss my parents. And I used to self-harm, and I'm afraid I'm gonna do it again.
Okay, so let's go back a little bit and tell me, where did you guys come from?
We came from Mexico. And we came here, and at first we lived with my uncle, and then we got a house ourselves. But I don't know what happened with this new political administration, and they made my parents go back home, and I have no one. I'm here in school, so that's why I got to stay for now.
Okay, and who is they?
They, DACA, the government, the American government.
Yeah, and I'm sure that it's hard to go through school without the support of your family.
Yes.
Are you able to talk to your parents at all?
Actually, no. I'm not sure what happened. They made them go back. I can't contact them. My uncle says he's going to get someone to, actually contact them, but, they're not giving me any answers because they know my history of anxiety, and, I get really worked up. And I had the self-harm from before, so I'm not sure.
When you said that you're worried about. All right, Maria, thanks for sharing so much with me. I know it can be hard to talk about. If you don't mind telling me, what are these thoughts that you have? Are they voices telling you to harm yourself?
Well, sometimes I hear voices, they come sporadic, like when I'm by myself. I'll hear something, you're not worth, like I'm not worth living, and that's what I was feeling with my anxiety and my depression. And they were just telling me to, I'll feel better if I cut myself.
Okay.
So.
Do you think that you would feel comfortable going to a self-harm support group and talking to other people who have had the same experience or similar experiences as you?
Is this like in a group, or would it be like a one-on-one person with like you, like we're talking?
It would be a group setting, and it'd be with people that have used self-harm in their past as well.
I'm not sure how I will deal with a new group. It's kind of hard for me to be with new people, and since I'm from another country, I kind of feel like a fish out of water most times. But if it'll help, I'll try.
Okay, that sounds great. Maybe we can work more towards doing that once you're more comfortable with being around others. Does that sound good?
Yes.
So if I'm hearing you correctly, right now you're not ready for the group, but some of your goals are getting back in contact with your parents.
Yes.
And succeeding in school.
Yes, of course.
Is there anything else that you'd like to work on?
I just would like to work on my, of course, sometimes I have panic attacks. If there is any way that, like with my anxiety, that I could, some type of, breathing techniques or something. I heard, I was reading about panic attacks, and you can do something with breathing or meditation. So do you have any type of program, like that I can go to?
We don't have a program specifically for panic attacks, but part of you coming to therapy is to gain the coping skills and the tools to get through those times when you're not here with me or when you're not in a supportive setting.
Okay.
Is there anything else that you wanted to focus on in your time here?
I would love and especially the family situation that I'm going through. I would love for you to help me with that, and the coping skills with my depression, anxiety. I would love that, the mental health skills, and because I want to get better. I really would like to get better.
That all sounds like great goal setting, and I think it's a good stopping point for today. When you come in next week, we can start talking about how you can meet those goals. Does that sound good to you?
Yes. Wonderful.
I will see you then. Thank you for coming in.
Thank you.
Hi, Maria.
Hi, how are you?
How are you?
Doing well, thank you.
Good. So how have you been? I know that you've been with us for the past 4 weeks in our program. How have you been adjusting?
I think I've been adjusting pretty well lately. I definitely feel a lot better from when we first began.
Okay. Have you've been meeting the goals that we laid out regarding your anxiety, depression?
I think so. I'm not really too sure. Like I said, I've definitely been feeling a lot better since when we first began.
Okay. Now, we had a plan for you, that, entailed group therapy, with our anxiety and mental health, with our anxiety and mental health program. And also, we had a crisis intervention, a family counseling for you. You told me in our last meeting that you were having problems sleeping because you missed your mom and your dad, who was sent back to Mexico. And I can identify with that a little bit too, because I'm a first generation immigrant here in the United States. So, I can identify with you also with that. So how are you feeling regarding that?
Regarding with what?
With your family, are you coping? Are you better able to cope with you being here by yourself and not with your mother and father?
It's still difficult being without them. We were a really close family, so just me not being able to be with them or see them, it's still difficult. I still get pretty sad sometimes and upset just thinking about them. I've been able to get in contact with them, but they're not here with me.
Okay. Well, that's part of our family counseling plan, is to, let you keep in contact with them. I know we have some resources in our group therapy sessions regarding patients that are detached from their family. Have you planned any of the goals, or have you completed any of the goals that were set out in the counseling plan, the family counseling plan?
Well, I don't think I've completed them yet. If we're continuing our sessions here, I'm not really sure exactly how I'm doing. I try to practice my breathing techniques to just calm myself down when I feel like I'm gonna have a panic attack.
Okay. How's school coming along? In the group session, I know that counselors and also therapists are there to help you in the group setting with if you're having problems in school with your work or anything. And they lay out a 3-point plan for goals and initiatives for you to complete and deal with, your schoolwork and, seek your mental health initiatives also. How's that going?
I think it's going well. I mean, I sometimes just do miss class because I don't feel like going, and I would prefer to be sleeping. But overall, I've definitely been going a little bit more than I used to at first.
Okay. Is there anything else you think you would like to tell me regarding your anxiety or depression?
Well, I mean, just like I said, I still sometimes feel really upset with not having my family around, and I'm glad that I have my aunt and uncle there, but it's not the same as having your mother and father there. And again, it's just really going back to me missing them and not being able to go back and to visit and them not being there.
Now, our program, you've been in the program for 4 weeks now, and we have a Step Up program also with clients who need, a little bit more help, after the 4 weeks are over. Would you be interested in seeking out our intensive patient program?
Yeah, I think so. I think at this point I would probably be willing to do anything to help me get better so that I can return to focusing on school. Because again, that's just one of the priorities of why I am here and why my parents made that sacrifice.
Okay. Well, we'll come up with a plan for you to accomplish these goals. Our intensive client-based program is, it's similar to the one that you are in right now, Maria, but it's a little bit more. It's a little bit more intensive, and you will definitely get the help that you need. You will get the help you need in your skill set for school, being able to keep up with your work at school, and you will be helped with your anxiety and depression. And then we will also still do the family counseling for you. Does that sound like something that you would be interested in?
Yeah, that sounds like it would work really great.
Yeah, and as before, this plan includes, total confidentiality, for you, okay? Anyone who you want to see your information, you'll sign off, a waiver to let, if you want your parents, to see your progress, or if you want the school to see your progress, you would be able to sign off on a waiver to let those people, see what you're doing. Okay? Okay. In this program, it lasts, instead of 4 weeks, you'll be in group therapy 8 weeks.
Okay.
And it clearly focuses on the client. This will be Monday through Friday. After you go to school and do your school time, and then we also have a Saturday session. If you need, for therapy, also a Saturday group therapy.
Okay.
So that'll be our focus for next time. We're going to intensify, your therapy, and we'll work on specific goals with your anxiety, your depression, your family therapy, and your school issues. How does that sound?
That sounds great.
Okay, wonderful. Is there anything else I can help you with?
No, I don't think so.
Okay. Well, good luck, and you have a good day.
You too. Thank you.
Take care.
Hello? Hi, Maria.
Hi, Chris. Nice to see you again.
See you as well. How are you?
I'm good.
How have you been feeling lately today?
I feel a little bit better.
I'm glad. It's really great to hear. How's treatment been going for you?
It's been going well. I feel like I'm getting some help, and going into the more intensive program, I've been getting more resources and ways to cope with what I've been going through.
It's great. So what type of coping skills have you been practicing with them there?
They've been teaching.
In regards to resources, I know you mentioned resources. How has that been for you?
It's been good. I think I'm closer to getting to talk to my parents again and figuring out that whole mess that was going on with immigration.
That's great. Even here, we would provide you with those types of resources given outside of once we're done with the termination and everything, and then once you're gone from that inpatient facility and you go out to outpatient facility, we still provide you with those resources to help you out better.
Okay. So am I going to be terminating soon?
Yeah, that's actually something that I wanted to talk to you about as well. You've been progressing very, very well. I can see the changes in your behavior, and even with my communication with the inpatient facility, they've said that you've made some really great progress.
I'm kind of scared to be out on my own again and not be meeting with you guys as often.
Okay, well, that's something that I can definitely talk with the inpatient facility as well. Maybe we probably still provide you with outpatient services, so that way you'd still be able to meet with us. But again, I think you've definitely met the criteria to just move out of the inpatient facility.
Okay.
What are you mostly afraid of being out there?
Just not having someone to talk to if I'm starting to feel down, or if I get stressed out about my parents again. What if I feel like cutting, or what if I do get sad or not want to leave the house again?
Okay, that's definitely very reasonable to be afraid of. But like I said, we're definitely going to provide you with these resources, and we're definitely not just going to drop you and leave you off on your own. We're going to still provide you with, so you don't need to worry about that.
Okay, thank you.
All right. In regards to like afterwards, once termination begins, you plan on going back to school?
I want to go back to school. It seems like it might be overwhelming to be so busy and dealing with my roommate again.
Okay. Have you thought about going to school maybe closer to home, to your aunt and uncle?
I don't know if they have as good of a college out there, but what do you think? Would I be able to go part-time?
I think definitely part-time would be a great idea, so you can remove a little bit of that overwhelmness off your shoulders. Again, just with your roommate, we would definitely try to see what we can do and find some different solutions with your school, as well as maybe even getting you a single room or just a roommate that could best fit for you as well. How does that sound?
That sounds good.
Yeah, okay. So in regards to your coping skills, what type of coping skills have you been practicing with?
I have breathing exercises to help me calm down, and then I meditate sometimes at night just to de-stress after the day. And then I just try to really not stay at home if I'm feeling depressed and get fresh air.
That's great, that's great. I'm really happy that you've been practicing that. And again, we we definitely implement those coping skills with you so that you can be practicing even outside of the inpatient facility. So once you're out back to school, or whether that's home, we provide you with those services to better help you cope. And then just one last thing that I want you to remember is as well, like once this once we do finish these sessions with you, just remember that you're not going to be alone. There are definitely other services in which you can contact if you are ever feeling very stressed or feeling down.
Okay. Do you know any other coping skills that I can use for my anxiety?
For your anxiety, definitely, yeah, we can definitely practice different coping skills. What usually tends to calm you down? What usually helps you out, aside from what you've practiced?
I think removing myself from the situation and knowing my boundaries, but sometimes I feel obligated to stay in the situation I'm in if there are other people involved, so I can't always practice boundaries.
Okay. Alright, so then sometimes just, like you said, just leaving the situation, right? Okay, so I definitely would encourage you to practice a little bit more, regardless if there are people around. Again, just step away, and then even then you can still use those breathing treatments that you use as well.
Okay, I think I can do that.
Okay. Alright then, Maria. Well, like I said, I think we probably have maybe a session or two more. We'll go and talk a little bit more in depth about that next session, okay? How does that sound?
That sounds good.
Okay, Maria. Well, I think we can all wrap things up right here, and then I will see you next time, okay?
Okay, thank you.
Alright, Maria.